With the HIV outbreak in southeastern Indiana, it has raised an awareness of HIV in Indiana. It's a concern for us here in Vigo County. We're in the top 5 of the incidence of having HIV in Indiana, and looking at ways to test and follow up on our citizens to make sure that they have the help that they need so that we can slow down or lessen the spread of HIV.
And when we talk about lessen the spread, a lot of people are now asking those questions. How do we stop this? And they're being very critical of the responses. Where do you all come into play? What do you all do?
One of the main things that we can do in Vigo County as a health department is get information out so that people can make an informed choice. And whether that means, should they be tested? Where can they be tested? If it is a positive test, what does that mean for them, and where do they need to go for resources? And what does it mean for them health-wise? What does it mean for them legal-wise? Indiana has a duty to warn, which means if you have HIV or AIDS, you must disclose to either partners prior to engaging in relations with them, your physicians, laboratories, anyone that would be at risk of contracting the disease. It's called duty to warn, and it is a felony if you do not disclose your status. And at the time of diagnosis, an individual signs this paper, and they are held to it in Indiana, and it helps us act as a deterrent for people engaging in high-risk behavior and infecting others.
Now, when you say act as a deterrent, is it actually working? Is it doing its job?
It's meant to do its job, as a lot of Indiana codes and laws are. Are there ways that it could be handled better? Yes. I think that in Indiana we have room to improve on the way that we test and treat and follow up on, especially follow up on individuals that have HIV, especially those that know they have it, and keeping them from intentionally spreading it to other individuals. Indiana is divided into districts, and whether that means through bioterrorism, whether it means through State Department of Health, Homeland Security. And so one of the ways that Indiana looks at addressing certain communicable diseases, and HIV being one of them, is that when a person is diagnosed, that reportable disease form, it goes to the state and then to the district, and then the district has what's called a disease intervention specialist that goes out and they talk to the individual that's been diagnosed and want to make sure that they have the proper medical care, it may be whatever type of assistance that they may need to try to hook them up to it. But with that also is letting them know what that duty to warn means. There's a time lag between when that diagnosis occurs and when it's followed up on. We have a situation where we've had a person that was diagnosed in the spring, but the disease intervention specialist didn't make it to interview the person until August. And that's a lapse of time where the person could either have been in treatment or have understood what type of precautions they need to use to not infect other people, to lessen their chances of engaging in high-risk behavior by having the information that they need. So it's the situation in southeastern Indiana will hopefully have us take an overall look at the way that we deal with HIV and AIDS in Indiana and look at where there are gaps, what we could be doing better, and enhance the way that we do public health. When we've looked at the situation in southeastern Indiana, what makes it unique is how many cases of HIV have been diagnosed, and they have been linked to needle usage. That's the primary mode of transmission. When looking at getting the help that those individuals need all the way around, drug treatment, medical care, psychological needs if that's the situation, whatever they may need. But we have to remember that there are other modes of transmission that people need to be aware of to lessen their risks, whether that means engaging in safer sexual practices, not sharing needles. As we look at the outbreak in southeastern Indiana, and it is primarily needle related, that is not always the case. Here in Vigo County, we've been dealing with a situation over the last year where we have, to the best of the information we've gathered, at least 9 individuals that are positive, 8 with HIV, 1 with AIDS, that are linked to one individual. But it's looking at when somebody is diagnosed, making sure that they understand their disease and what they can do, what they need to do morally and what they need to do legally not to continue to spread the disease. We were notified by the State Department of Health last year of an individual in Vigo County that as the years progress that we have found out that has infected 8 people with HIV, 1 with AIDS, one person has AIDS. And we're looking at making sure that these kind of situations don't occur to the best of what resources we have. And we've worked with the state police, currently working with the prosecutor's office, because when you have something like HIV, when you have HIV and the state code tells you that you're supposed to tell people that you have this duty to warn, you've signed the duty to warn, and you still don't adhere to it, and you taunt people that you've infected and tell them after the fact that you've given it to them, and sure enough, when the person's tested they do, then it needs to be stopped. And we take situations like that serious, and we'll do everything within our powers to stop that person and to stop anyone else that knowingly harms others.
So are they looking at trying to bring charges to this one person based on that code and that felony?
That'll be up to the prosecutor's office.
So is that person still out there able to infect others?
At this time, they're currently not.